Hello, my name is Jasmine Atilano, and today I'm going to be focusing on the case study of Sean with my group members. And we're going to be focusing on programs that would be helpful for him, such as the substance use prevention program and multi-systemic therapy.
Hi, my name is Essence Green, and I'm going to be talking to you about our case, adolescent Sean. He is 16 years old, gender male, ethnicity white American, background lived with his father and mother, limited prior criminal history, but ongoing emotional and family conflict. Let's go over the case summary. In December, in December 1998, 16-year-old Sean attacked his sleeping father at night and was charged with attempted murder. Let's go over offense details. Sean committed a serious violent assault against his father. Sean stabbed his father multiple times while his father was sleeping, causing life threatening injuries. The incident Sean committed was impulsive and rooted in long standing emotional distress. Feelings of isolation and unresolved family tension. His father ultimately survived the attack.
The final verdict is that Sean will be in the Santa Clara Juvenile Hall. There he will be monitored and educated until he is the age of 19. Um, because of the outcome of his family support, he was able to stay in the juvenile hall detention.
Let's talk about the key risk factors. Substance use. Sean's substance use of marijuana makes his ongoing brain development vulnerable to his future mental health problems, such as the increased risk of addiction. The brain development can increase his likelihood of mental health disorders such as depression, anxiety, emotional distress, and risk in behavioral aggression. Parental abuse. His father goes on business trips, leaving Sean and his mother home and telling Sean to make sure his mother does not drink. This is a risk factor because it leaves an adolescent in lack of parental support and parental discipline.
Some key protective factors would be the family support. Although Sean's parents were affected by his delinquency, they still supported him by going into important discussions of having him not go to an adult court, but instead a juvenile detention. This is more family involvement while he is at his lowest of finding resources to help guide his past actions. Education in juvenile detention. Although Sean is serving his sentences in juvenile detention, they allowed him to continue his studies in community college classes. This would continue to construct a better cognitive system for his future release. Monitoring. While Sean is serving justice in juvenile detention, they are monitoring his actions and giving him a consistent schedule to a positive environment with support to reduce his delinquency.
For the substance use prevention and treatment program, this provides it's appropriate for Sean because it allows him to receive that appropriate information of drugs and alcohol to both Sean and his parents. This will normalize his health curiosity and risk taking behaviors and the desire to become independent with their caretakers. And it provides formal assessment that includes looking at risks and protective factors within the context of each individual's use.
Multi-systemic therapy. This is where they reduce serious delinquent behavior, it builds family functioning and supervision, improves emotional regulation and social skills, it straightens school engagement and reduces recidivism.
Now we're going to talk about program effectiveness and developmental appropriateness. Let's talk about substance use prevention and treatment program and what it provides. It provides standard screening assessment. It also provides comprehensive and integrated services. It also focuses on family focused. To promote the most lasting changes, they promote family involvement, also promote also offer treatment interventions that incorporate evidence-based interventions such as motivational interviewing and guiding good choices curriculum. Curriculums are applied to effectively provide prevention and treatment services to youth and families. Tailored services. The program offers specific groups for boys and girls where each youth has a voice in a safe space to talk about their issues.
Program effectiveness and developmental appropriateness, multisystemic therapy. What makes multisystemic therapy work? It treats the teen within their real environment, as in their home, school, peers, and community. It targets multiple factors behind substance use. It builds problem solving, emotion regulation, and refusal skills, involves caregivers even when they're absent or low involvement is present. It reduces risk behaviors like drinking, delinquency, and peer pressure. How multisystemic therapy helps a teen with alcohol use and family absence. It increases positive adult support like therapists, mentors, community members. It strengthens family communication and involvement when possible. Builds healthy coping skills to replace alcohol use. Reduces association with substance using peers and risk environments. Helps the adolescent form structure, accountability, and self control.
For my evidence-based practice, my article was with Sharma et al. And this was a 2024 article about substance use prevention and treatment programs and how it was effective for them. The areas of adolescent development has improved. It helped them with emotional regulation. It helped healthy decision making and behavior change skills. It encourages responsible substance use or abstinence. And for this case, for Sean, it would help him a lot since he had the drinking problem. It would help him lower that addiction. It strengthens coping skills, especially during stress or cravings. And it supports long term change through social support and environmental change. And the rehabilitation outcomes helps reduce the smoking, vaping, binge drinking, and drug use. And it's effective in preventing relapse and improving sustained quit attempts and encourages continued commitment to sobriety over time. And in this article, it worked best for youth, adolescents who have used alcohol, and people who, well, young people who are willing to quit their substance use.
Here are some evidence based practice for the multisystemic therapy. CBT, cognitive behavioral therapy, which helps reduce drug/alcohol use, builds coping and decision making skills, works well with Hispanic youth and justice involved teens. ACRA, Community Reinforcement Approach. This helps with lowering substance related problems, effective for teens on probation or with substance use disorders. Family based treatments, as in MDFT, FFT, BSFT, which is the most effective overall. It helps decrease crime, arrest, and behavior problems, helps with substance use and emotional improvement, best for juvenile justice youth and culturally diverse adolescents.
Thank you.